Hey everyone, welcome back to our channel. Today we're talking about something that could literally save lives. Signs of cancer that most people ignore. Did you know that early detection can mean the difference between a manageable condition and a life-threatening situation? Cancer doesn't just strike suddenly, it often whispers before it screams. Your body gives subtle signals, but the question is, are you listening? In this video, we'll uncover 10 warning signs that could indicate cancer. These are symptoms people dismiss as nothing serious, but they can be critical red flags. So grab a seat, pay close attention, and let's dive into these life-saving signs. Our bodies are pretty amazing, right? They're constantly changing and adapting, but sometimes these changes can be a sign that something's off. One of the first things I always tell my patients is to be aware of any unexplained lumps or bumps. Think about it, our lymphatic system, which helps fight off infections, is a network of nodes and vessels all over our body. If you feel a new lump, especially in areas like your neck, armpits, or groin, it could be a sign that your lymph nodes are working overtime to fight something off. And it's not just about lumps under the skin. Pay attention to any unusual changes in your skin's texture, color, or the appearance of moles. Have you noticed a mole changing shape, size, or color? Or maybe a sore that just won't heal? These could all be potential warning signs of skin cancer. Remember guys, early detection is key when it comes to cancer. Take a few minutes each month to examine your body. It could literally save your life. If you see something, say something. Don't hesitate to bring it up with your doctor. We've all been there. A big meal, maybe a little too much spice, and bam, hello heartburn. It's totally normal to experience indigestion every now and then. But what if it's not just a one-time thing? If you're dealing with persistent indigestion or having trouble swallowing, it's time to pay attention. Your body might be trying to tell you something more serious is going on. Now, I'm not saying every case of indigestion is cancer, but it's always better to err on the side of caution. Think of your digestive system like a highway. Food travels down your esophagus, into your stomach, and through your intestines. If there's a blockage or irritation along the way, it can cause a whole lot of discomfort. Persistent heartburn that just won't quit, even with antacids, could be a sign of something affecting your esophagus or stomach. And if you're experiencing difficulty swallowing, like food is getting stuck, that's definitely a red flag. Don't ignore these signs. Make an appointment with your doctor and get it checked out. Let's be real, mouth sores are the worst. They're annoying, they can make eating a pain, and let's be honest, nobody wants to deal with them. But did you know that a mouth sore that just won't heal could be a sign of something more serious? Now I know what you're thinking, every little thing can't be cancer, and you're right. Most mouth sores are harmless and go away on their own within a week or two. But if you have a sore that's sticking around longer than that, especially if it's painful, bleeds easily, or is accompanied by white or red patches, it's time to get it checked out. For those of you who smoke or drink alcohol regularly, pay extra attention to your oral health. These habits increase your risk of developing mouth cancer, so it's crucial to be vigilant about any changes in your mouth. Remember, early detection is key. Don't be afraid to talk to your dentist or doctor about any concerns you have. They've seen it all, and they're there to help. Blood in urine or stool? Okay guys, I know this is getting personal, but we need to talk about something that can be a little uncomfortable. Blood where it shouldn't be. Trust me, I get it, nobody wants to discuss this, but ignoring it won't make it go away. Seeing blood in your urine or stool is a huge red flag and you should never ever ignore it. I know it can be scary, but it's important to remember that blood doesn't always equal cancer. There are many potential causes, some more serious than others. Bright red blood in your stool could be a sign of hemorrhoids, which are common and usually harmless. However, dark, tarry stools could indicate bleeding higher up in your digestive tract, which could be a sign of something more serious, like colon cancer. Similarly, blood in your urine could be caused by a urinary tract infection, kidney stones, or other issues. But it can also be a sign of bladder or kidney cancer. The bottom line is, if you see blood where it shouldn't be, don't panic, but don't ignore it either. A cough or hoarseness that won't go away. We all get coughs, especially during cold and flu season, but what happens when that cough just won't quit? If you've been battling a cough for weeks and it's not getting better, it's time to take it seriously. A persistent cough that lingers for more than 3 weeks, especially if it's accompanied by other symptoms like shortness of breath, wheezing, or coughing up blood, is definitely something you need to get checked out. And listen up, smokers, you're at a higher risk for lung cancer, so a persistent cough is something you should never ignore. Now, a cough isn't always a sign of something serious. It could be allergies, asthma, or even acid reflux. But it's always best to err on the side of caution and get it checked out by a doctor. Unusual bruising. Have you ever noticed a bruise and thought, where did that come from? We've all been there. It's normal to get bruises from time to time, especially if you're active or accident-prone. But what about bruises that seem to appear out of nowhere, or ones that take forever to heal? Those are the ones you want to pay attention to. If you're noticing more bruises than usual, especially in unusual places like your back, hands, or abdomen, it's worth talking to your doctor. Easy bruising can be a sign of several things, including certain medications, vitamin deficiencies, or even something more serious like a blood clotting disorder or certain types of cancer. Your blood is responsible for clotting, which helps stop bleeding when you get injured. If your blood isn't clotting properly, it can lead to easy bruising or bleeding. This can be caused by a variety of factors, including certain types of cancer that affect the bone marrow where blood cells are made. Persistent fatigue. We live in a society that glorifies being busy, but feeling tired all the time shouldn't be a badge of honor. I'm talking about the kind of fatigue that doesn't go away, even after a good night's sleep. If you're constantly feeling drained, even after making lifestyle changes like getting enough sleep, eating a healthy diet, and managing stress, it's time to listen to your body and talk to your doctor. Persistent fatigue can be a sign of many things, from vitamin deficiencies and thyroid issues to more serious conditions like heart disease, autoimmune disorders, and yes, even cancer. Yes, I know you're stressed, you work long hours, and of course you're tired. And while that's definitely understandable, it's important to remember that our bodies are incredibly resilient. Pain is our body's way of telling us something is wrong. It's like that annoying check engine light in your car. You might not want to deal with it, but ignoring it could lead to bigger problems down the road. If you're experiencing new or unexplained pain, especially if it's persistent and doesn't improve with over-the-counter pain relievers, it's crucial to get it checked out by a medical professional. Don't just brush it off as getting older or stress. While those factors can definitely contribute to pain, it's important to rule out any underlying medical conditions. Pay attention to the location, duration, and intensity of your pain. Is it sharp or dull, constant or intermittent? Does it radiate to other areas? These details can help your doctor determine the cause of your pain and recommend the appropriate treatment. Fevers are our body's natural defense mechanism against infection. They're like your internal fire alarm, signaling that something's not quite right. But what happens when your fire alarm keeps going off for no apparent reason? If you're experiencing persistent low-grade fevers, especially if they're accompanied by other symptoms like night sweats, chills, unexplained weight loss, or fatigue, it's time to see a doctor. These symptoms could be a sign of a hidden infection, autoimmune disorder, or even certain types of cancer. I can already guess what's on your mind. I had a fever last week, and it was just a cold. And you're probably right. Most fevers are caused by common viral or bacterial infections and resolve on their own within a few days. Okay, you're probably wondering, losing weight without trying sounds like a dream come true. And while it might seem like a good thing, sudden, unexplained weight loss is actually a major red flag that you should never ignore. If you're losing weight without making any changes to your diet or exercise routine, and especially if you're losing more than 10 pounds without trying, it's crucial to see a doctor to rule out any underlying medical conditions. Sudden weight loss can be a sign of a variety of health issues, including hyperthyroidism, diabetes, malabsorption disorders, and yes, even cancer. When your body is fighting a serious illness like cancer, it can burn through calories at an alarming rate, leading to unintentional weight loss. And there you have it. 10 cancer warning signs you should never ignore. Your body is constantly sending signals. The key is to listen. Early detection saves lives. If you or someone you love is experiencing any of these symptoms, don't wait. See a doctor, get it checked, and advocate for your health. It's always better to be safe than sorry. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe for more life-saving health tips. Stay healthy, stay informed, and we'll see you in the next video.